So my name is John Jordi. I'm a lymphedema therapist, but I've been in physical therapy for the past 30 years. I've been a lymphedema therapist for about the past 24 years. I'm a certified instructor for the academy. I've been a senior instructor there for a lot of years. I've done a lot of treatment over the years, all related to lymphedema at this point. And currently, I'm holding a job working in a vein clinic and also working as the clinical manager for Juzo USA. So physical therapy, I graduated from Minneapolis and it just was a great job fit for me. I was an athlete. I liked working with athletes, but I got interested in wound care at some point. And when I was working at the hospital here, we were doing a lot of things with wounds that weren't always working. And many times I had done wound care programs where they talked about these fibrin issues and these protein issues. And a therapist had gone to a class specifically to treat this. And so I was so interested, I became a CLT as myself. And what happened was I completely changed the wound care at the hospital to address veins and venous wounds and venous insufficiencies and chronic edemas in a very different way with amazing results. And that just really inspired me to stay in the field. And since then, I've just continued to progress along, doing multiple research projects with universities, as well as becoming an instructor for the school I learned from. Yeah, so lymphedema, when I first started back in 99, things were really unknown, at least in my general area. And what we had noticed is that, the treatment had really moved quickly. We had 5 lymphedema programs in town within just a few short years, and we saw a lot of really good outcomes and patients getting a lot of treatment. So things that are different now is that there's no lymphedema big programs any longer in my general area, and we're seeing it much smaller scale. And I think that's become a kind of a problem is that patients don't always have a lot of places to go anymore because therapists don't always have the interest, or it's just been really difficult. So that's one of the changes that's not been great. But one of the big changes that just happened a couple weeks ago is with the advent of the Lymphedema Treatment Act, compression garments, that's really been one of the hardest parts. Um, Patients haven't always had access to garments. If you're on a fixed income, Medicare, these are very expensive garments and they're absolutely necessary. I tell therapists when I teach classes, if you don't end a patient in compression garments, you have not finished the job. Patients need to end in a garment so that they feel like they've got some level of normalcy and some ability to take charge of their own lymphedema issues. But if you're on Medicare, if you're on fixed incomes, a lot of these things become a problem. So now that this pass through legislation has become official, there's the potential that these patients could be getting garments, and we could be seeing an increase in lymphedema programs because patients now can get treated and they can finish treatment appropriately. So, what I would tell any patient is if you're going to start this, you need to be ready to finish and you need to really be all the way in. Patients who just dip their toes into lymphedema treatment almost are always frustrated because they think that they can just do a little bit here, a little bit there, and they're going to get better. And the fact is, you don't get better at all. You're actually going to see yourself continue to get worse over time because lymphedema is unrelenting. It never stops progressing if you don't do something about it. And constant compression and constant containment is really the key factor. You have to do your part. I remind many patients it's like having diabetes. If you don't manage the diabetes, it will manage you. And there will be long term consequences. You may not always get to choose. So treat it now, treat it aggressively, and get a handle on this. For therapists, I would tell them vet the patient well. Make sure that the patient is already ready and fully understands what the program is, because therapists who let the patient drive the treatment program really end up doing a disservice to patients because the patient doesn't know what they don't know. And so the therapist should be able to educate them during the evaluation to make sure that the patient fully understands what they're getting involved with. So when they're ready, they're really ready. I make it akin to this. What physician would ever tell a patient, we need to cut your knee off, we're going to replace it with metal and plastic inserts, put you back together, you're going to have a lot of discomfort, a lot of problems, and that's your total knee replacement? Nobody begins with that. We know that there's a lot of work to a knee replacement, but what we focus on is the after effects, the outcomes, the long-term independence that you'll have from being free of the pain, the joint dysfunction, and all the other problems that come with knee arthritis. So in lymphedema, we only focus on the problems, not on the long term. And that's where we need to focus is that if patients understand, I will learn how to manage this myself. I will learn how I can be independent and I will learn how I can get the better part of my life back. Yes, I'll have to make changes, but what we're really after is the patient to be able to have a new normal that they can find acceptable. And that's the responsibility of a therapist to help educate that patient to understand it. Yeah. So how do I work with Pretty in Pink? The important part is that Pretty in Pink has really done a great job as a DME provider for patients. Now, what is DME? It's durable medical equipment. In lymphedema, that's a really imperative part of treatment. You cannot treat without having it in hand. So when I'm looking for patients to get their benefits, we utilize a company like Pretty in Pink to look at all their benefits and get the maximum for the patient. So we're talking about bandaging. We need to reduce the patient. So I need to know that they can get the bandaging for the patient. I need garments. And then I also need nighttime garments because compression's required 24/7. Patients without consistent containment and compression, they will get bigger and the garments won't fit. So they need to have all of that. And as a therapist, I'm concerned about the treatment of the patient. I don't want to have to think about what garments am I going to choose right now or what's their benefits. I want to know that I can treat my patient and be thinking long term that I need day and night time garments and bandaging for reduction. But I'm also thinking, can I get this treatment done? Because I still have to focus on therapy and what their benefits are for therapy. So I want to just submit off the information of what I want and let a company do the job right. I've worked with other companies that haven't always been helpful. Pretty in Pink has always been able to step up and say, "Hey, by the way, did you know that they have benefits for a nighttime garment? Have you thought about this type of product?" And what I really like is that they're clinicians and certified fitters that aren't just somebody that doesn't know products or patients. These are people that also work in the field just like I do. So when I'm making decisions, they're also bouncing ideas off me to make sure that I'm getting the best for my patients. So I like that they can do all the billing. I like that they can do all the work. And I like that it's all remote. In my area where I live, many patients say, well, do I need to drive to this place? The fact is, no. I do all my own fittings and I manage all of that. But the patient can get all the billing done in a proper and appropriate way to make sure that they're getting the maximum amount for their benefits. And so I really appreciate the fact that Pretty in Pink can manage all the billings, all the ordering, and they send it straight to me so I can fit the patient and get it done right.